Welcome to Go Central, celebrating all the great things in Central that make Central the greatest place on earth to live, work, play, and raise a family. It's Dave Furneaux and Kristen Perrin, and Gordy Rush will be joining us shortly. Tonight, we've asked Tom Copeland of Central Physical Therapy to hang out with us for a little while and tell us their story and maybe field a few questions. Tom, thanks for being with us.
Well, thanks for asking me. I'm happy to be here.
As anyone watching on either Facebook or YouTube might note, you can chat. You can send in a question or a comment if you'd like, and I'll be able to see them. We can relay a question if you'd like. And Tom, you've of course, I guess give us a little history. Let's rewind back to where Helen Bosley, your business partner, started many years ago, and give us your introduction onto the scene.
Well, Helen's been in Central for probably close to 40 years. She started working here about that time for another firm and worked with them for quite some time until about 2001. I think it was 2001. She went into business for herself. And she, Helen being a great person and being everyone's physical therapist, she was doing a great job seeing people, but essentially she was just not making it as a business. So at one point, while I was in the business of consulting with small private practices around the country, I had my own practice for many years and sold it. And then after I sold it, I was scratching around saying, now what do I do? And I think came up with the idea that I was going to help other small practices around the country learn how to be businessmen and not just be physical therapists. So in that process, I met Helen and she asked me to come down and see what I could do about helping her with the business part of her practice. And when I got down here, it was a little bit of an eye opener, a shock for me. When I first rolled into that building that we had many years ago, 18 years ago, when I showed up, it was just a little old building that had been kind of used up for many years. And you would never associate that building with a medical practice because it looked like this little old building sitting off of Hooper Road. And because back up in Minnesota, where I came from, I was in Minneapolis, St. Paul area, and had developed 8 different offices over the period of my practice. And some of them were in fancy, big 8, 10-story medical office buildings with underground parking and the whole thing. And to drive into down Hooper Road into this little old building that was kind of sitting back there was kind of like, oh my gosh, they do physical therapy here.
Well, now, Tom, if I can interrupt, isn't that family property, and weren't those some houses that were on their family property at that time?
Yes, it was family property, and there were several houses on the property, on both sides. And in fact, some of the history of that property was that her father had been a veterinarian here in Central, and one of the houses farther down was the old vet clinic. But at that time, it was closed down and vacant. But at any rate, when I arrived on the scene, Helen and I began working closely together to help her develop her practice. And we sort of grew fond of each other, and we decided that I should just get my Louisiana license and hang down here for a little while and see how things went. And 18 years later, here we are, still working together. We're partners in the business. We're partners in our life. And we worked that old building for a few more years, and I think we squeezed out of it about every possible inch of space that we could, and decided that it was necessary for us to get bigger. So about 7 years ago, we were fortunate to get a loan from Washington State Bank in Lafayette with a significant loan guarantee from the USDA. And with that loan, we proceeded to build a brand new building, 6,500 square feet. And when we were designing the building, we thought, well, there's people of Central need good quality physical therapy. They need to be able to stay home for their therapy. And we wanted to be able to provide a variety of services that would be beneficial for the people of Central. So we developed a swimming pool, not a swimming pool, but a therapy pool. We developed a track that allows people to walk with harnesses aiding them in their ambulation. We were able to attract Richard O'Quinn into our practice. Richard is one of the very few people that are what's called Erdmann certified in vestibular therapy. And so it has been very beneficial for a lot of people of Central who have problems with dizziness and unbalanced problems to be able to access us here without having to go somewhere else. In addition to that, why we're also able to hire Eric Strahan right out of school. And I think that's been almost 12, 15 years ago. And Eric is wonderful. He's a great sports physical therapist. A lot of the children and high school athletes spend a lot of time with him. Eric is our person that goes to Central High School and works with colleges with the athletes. He's at most of the football games. He goes to a lot of the other sporting events. A lot of times he'll spend time in the afternoon over at the school during school, when we have school. Some of the practices, and he's quite busy treating a lot of our athletes. Of course, the last person, not the last person, but the person that I should be talking most about is Helen, because she's the heart and soul of the practice. She is the person that the practice is built around. She has started long ago, and with her expertise and her knowledge and with her abilities and her experience, over time, we have gradually grown to the point where we have a patient base right now of over 5,000 patients that we've seen, and we're getting referrals from somewhere over 500 different doctors. It's just been a phenomenal explosion of business for us, given the mix of people that we have. Now, more recently, we both sat back and looked at just where are we going as a business? What are we doing? We're very busy. We survived COVID. We're slowly starting to build our way back again. We had to shut down for 6 weeks, and that almost did us in, but we were able to recover and come back. And as we started looking at, well, what's our future? What are we going to do? We entertained a lot of different options, a lot of different ideas. And ultimately, we settled on the fact that this is home. This is my home now. This is Helen's home. And our business is something that we've grown. It's kind of part of us now. It's not like a business where you can say, okay, well, I can walk away from it. I go home, it's 5 o'clock, let's go home and shut the doors and go party the rest of the weekend. This is part of us. We're always there. We're part of it. I'm there every day. And if you drive by Saturday mornings or Sunday mornings, you'll see my car parked out there doing something to make sure the business is running right. And we had decided that moving forward, we needed to also think about how we were going to move forward. And at the same time, we started looking at, well, we are so busy that it's starting to wear us out. So we need to look at refreshing ourselves and maybe do something to help enliven our business and give it a new life. And in that respect, we had the opportunity to hire 2 young new therapists that are fresh out of school, that are very eager to learn. They're Central residents that want to come back to Central, that want to be part of Central. And so in June 1st, we hired Sarah Frew. And Sarah's done a lot of work in dance in a lot of areas around Central and fairly well known. And she was kind of cute because during an interview, we interviewed several people for this position. And I was talking to Helen about one. I said, oh, this girl's really a hard worker. I don't know, maybe we should think about her. She's got some experience. And then when Sarah came in and interviewed with us, she just blew us away. I mean, there was hands down, no option. This is the person we want to work for us because and I haven't really said this to either her or Helen, but I kind of see her as young Helen because she's energetic, she's athletic, she goes after it, she comes into the room, everybody knows she's there, she's larger than life, and she's just has become sort of a place for even staff and patients gravitate towards her when she's around. And we tell the story about when we were interviewing her. As part of that interview, as the interview was winding down, we were kind of talking a little bit, and then one of us, Helen or I think, mentioned something about, well, don't you have a brother that's a PT? And she goes, yes. She said, Jacob. And she kind of looked at us a little shifty. She said, I'd really like to get a job for my brother too. So we had heard some good things about him, and so she told us a little bit, and we said, all right, let's give us this number, let's call him, let's interview him, let's see what Jacob's got. And sure enough, he came in. Jacob was just did the same thing. He's not quite the energy that she has, but he's a good, solid, respectable person. He just wowed us. Very polite, very knowledgeable, very down to earth. And so we offered him a job on the spot. We're kind of on the fence about whether we needed to take on another employee, but it's one of those situations where the opportunity is there. It's someone you know that's going to be good for you and for your business, and that you're going to be good for them. So let's go for it. Let's hire him. So actually, Jacob had commitments with another place he was working, and then he just became a father a few weeks ago. So through all of that, we weren't able to get him started, and actually today was his very first day. So we spent the day together, he and I, me bringing him onto the practice, educating him, teaching him some of our routines and how we document, how we bill, and how we see patients. And we're just both really excited about the idea that bringing these two young people in is going to help energize our practice, going to help move us forward, and it's going to help us grow our business in the manner that we think that we can going forward. They have a lot of good ideas. They're kind of things that we're going to start trying to do in the future that maybe we did a little bit in the past, but maybe we're going to do more of. Few ideas that we just did that we kind of forgot about, and they're bringing to the forefront. So we're very happy they're there, and looking forward to them working closely with Eric and Richard as Helen and I continue to manage the business and maybe not have to spend quite so much time there like we have in the past, and enjoy life a little bit more as well as continue our practice. So we're anticipating Central Physical Therapy to be around for quite some time, and going forward with the new people that we have in place. So we've got a mixture of the old guard and the new guard, and a mixture of a variety of different types of conditions that people require physical therapy for, that we'll be able to offer to people at Central so that they don't have to go downtown 30-40 minute drive one way to get the specialty care they need, because there's very little in the realm of physical therapy that we can't offer here at Central PT. So kind of long-winded, but that was kind of my take on where things are and what we're doing.
Well, I'll tell you from a personal point of view, I said you've treated a lot of my family, and it probably touches on some of your expertise. My father-in-law, who's since passed, but he had big balance issues at the age of 91, 92 years old, and you guys did a wonderful job with him. My wife and my daughter both have had back problems and SI joint problems, and I'm going to tell you, Mia does her exercises every night on that SI joint and the L4, L5 area, and you guys have really whipped her into shape. You've saved her from one or several surgeries. She did succumb to one minor one, but you've kept her from being under the knife by the care you've given to her. Of course, you see my mother-in-law at the age of 93, and basically he keeps our family kind of taped together with baling wire and duct tape, and everything moves on. Everybody does their exercise, and you've done a great job with my family.
So I appreciate it, and your family, I think, is it's nice to have someone believe in you as they do and listen and comply with what you've recommended. There's so many people that don't always take the advice of the professionals and think that maybe they understand better than you do, but it's been a pleasure to work with everyone in your family, it's nice and it's gratifying to see them do so well when they listen and do what you ask them to do. And I think that's true across the board with many different people that we have seen from Central. Well, we do have a significant number of what you call repeat business, patients that had experience with this before that have been satisfied with what we've been able to help them with. And when they have another condition or another problem, they look to us and give us a call. You know, that's an area that we're looking at developing with both Jacob and Sarah. Recently in the last couple of years, there's been the opportunity for what we call direct access to physical therapy. Physical therapists in the state now have the opportunity to evaluate and treat for a certain period of time people who are in need of physical therapy or come to therapists who can see them in the scope of their practice without a referral, which has been the case for so many years. Now, we still take referrals, which most of our business is still referrals from physicians who send us their patients, but we do have the opportunity that if a patient wants to come directly to us, we can certainly evaluate, bring them in, do a physical therapy diagnosis and evaluation, and help them determine a course of care that may or may not be within our scope of practice, but we have the opportunity to do that. And I think in many times, if it isn't in the scope of our practice, then we have a good idea of where to direct them to get the kind of care that they need for their problems. And I think it's kind of helping us a little bit more in that line because both Sarah and Jacob, as well as Eric, have what's called their DPT or their doctorates in physical therapy now. It's a more extensive program than us old people that were around who had a 2 years in undergrad and 2 years in PT school, and we were out and on our way. Now it's 4 years undergrad and 2 to 3 years postgraduate to get your doctorate. And the doctorate is more than just being an expert in exercise. They learn across the board a lot about all the different disciplines of medicine and a little bit about all the different disciplines and have a much better grasp and a much better handle on what is and what isn't within their scope of care and what they can practice and what they can't practice. And that, I think, is going to be part of what helps us grow a little bit differently than we have in the past, but it still continue to grow and hopefully be a place for people look to when they have a problem that we feel we can help.
Tom, I wanted to ask you a little bit about your concussion technology, machinery. I remember years ago I went out there when it first came out, y'all were way ahead of the curve, and Dave alluded to it a little bit. You're balancing that technology, but especially in athletic space, know you work with the area schools, a tremendous asset to have that sort of technology out here to treat concussions.
Yeah, we do. We are what's called a concussion certified facility. Several years ago, both Eric and Richard were actually ahead of the game and were talking with us about concussions and providing a service for our athletes that had concussions before it became sort of the thing to talk about and write about and put in the newspapers. And we began investigating what we could do as physical therapists to help along those lines. Because I know Eric, as a certified athletic trainer, has a certain amount of training and experience with that. Richard, being the vestibular therapist and having a lot of training in analyzing and diagnosing and helping treat people with dizziness and concussion programs, studied and found a program where they could bring all of those pieces together to help develop a program that would work with a patient who had been concussed, that had a concussion. And the concussions are not just in football. You're seeing them in girls soccer. You're seeing them in basketball. You're seeing them in a lot of different places where we're seeing them in auto accidents. And by putting together this certified concussion program, what we're able to do is see an athlete who possibly have had a concussion early on, help them determine what their course of care should be, whether it should be working with a neurologist to get MRIs of the brain, whether they should be doing a quiet period, when they are in that quiet period, when they come out, what kind of activity should they be having, and how to progress them along with their concussion, looking at different pieces of equipment we have. We have it's called a BioDex balance board machine, where you stand on it like a Ouija board, and you look at it and you balance and try to get, it's like a Wii game where you try to put a little dot in a circle and do a number of other things along those lines. Richard has his goggles that he puts on people and looks at eye movements on his computer screen. And then as they become more able to have more activity, then Eric comes in with a lot of his sports knowledge on how to train athletes, how to train them in doing their particular activity, similar to we would be training somebody who recovered from a knee injury or an ankle injury, and help them come all the way back from the concussion back into full activity if the concussion is such that it will allow them to do that. At the same time, they're also cognizant and aware of that if there is a concussion probe that is beyond the ability to do these kind of things, that they also know to back off and to work with the physicians and the doctors on making sure that athlete is taken care of appropriately with their concussion. I can tell you a couple of times we've had some of the coaches over at Central come over, and a few of their athletes who have had the concussion and then been through our program came over and said, "What are you guys doing over here? They can catch the ball and run faster than they did before the concussion." So Eric's always proud of that because he does such a great job with those kids. And he and Richard working together has been a great team. And it's a great offering that we have in our program.
Well, I know I can speak for the cheerleaders to say that Eric is really good at what he does for helping all of us because, he's constantly helping our girls when they hurt themselves in tumbling or, they fall and have a hurt from falling from a stunt or something like that. Everybody always loves to go see Eric because he just does such a good job with them and gives them exercises they can do at home to help. And I know he's seen a lot of them, and he really he has a good name out there for himself. A lot of the kids really love him.
Yeah, and that's right. And he's such a good-natured person. Sometimes he's just a big kid himself, the way he does things. But we love what Eric does, and he's so smart. And we're looking at taking his knowledge and his experience and bringing that together with what we've got with Sarah and marrying those two people and their ideas and how they take care of people and be able to expand that even beyond into what Eric's been able to establish. Because I know both Sarah and Jacob are from Central Private. And so we've done some work with Central Private in their athletics, and we're looking for them to help pick up some of the slack there and be able to spend more time with the Central Private athletes. We're looking at bringing in a lot more opportunity working with Central Middle School. The Central Middle School is now becoming very active in sports and athletics, and we're looking at being able to help them along and be part of that program even more than we have, because now we have more of the people that will be part of it. I think also coming up this year too, we'll be involved with another athletic trainer for Central area involved in the middle school that will be somebody that's be able to spend more time at the middle school. That'll be part of what we're doing and part of our program.
It's a good sitcom in the radio world. It will transition to Central Middle. my son sprained his ankle last Monday, and he's been going over to see Eric this week. And one of the great advancements in technology has been the cryotherapy. Right. And release some of those boots and talk about that. And just, it's amazing to see how much quicker recovery times have come with technologies like the cryo boot.
So in the cryotherapy is talking about basically another way to apply ice or cold packs. And he's talking about what we call a game rig. It's what we call a vasopneumatic machine that you can apply, say, to a swollen ankle or a sprained ankle. That's got a boot in it that you can pump ice water through, and at the same time, you get the compression you need to control the swelling. So the combination of the ice water pumping with the elevation and the ice packs and the pressure expedites the removal of the swelling, because when you have an injury, the swelling and the edema and the inflammation that come along with that significantly interfere with the healing process. And if you can minimize that and get rid of it with the different compressions in the ice, then you speed up the recovery significantly. A lot of times people, and this kind of leads me into another segue just a little bit. A lot of people are always saying, well, I put ice on it for 24 hours or 48 hours, then I went to heat, and I just don't understand why my ankle swelled up again. Well, that's pretty much old thinking. And we've done this for many, many years, and some of the advances with the game radio and the vasopneumatic compression sort of emphasize this for us. But we recommend and use ice packs all of the time. Never go to heat unless it's something like a little muscle soreness from exercise, because anytime you have a damage to soft tissue, to ligaments and tendons, the inflammatory response actually creates an enzyme that's injurious or noxious to the soft tissue and makes it worse. If you can stop that, slow it down, you've reduced the amount of injury, and then you give the body a chance to recover. Because one thing most people don't understand, they think, oh, the ice pack is going to make me cold, it's going to constrict my circulation. Well, when you take the ice pack off, your body starts to warm up. And when it warms up, it warms up by bringing in a good, rich blood supply that helps the healing process. It doesn't bring in all what we call the exudates, the swelling and the scar tissue and all the junk that creates problems. So you're very right. That the cryotherapy is one aspect of being able to have athletes return to play very rapidly. Of course, we always, as physical therapists, encourage exercise and the right kind of exercise, active range of motion then leading up to resistive exercises and running and things of that nature. And then one of the other modalities or techniques that we use for the healing process that complements the ice and the cryotherapy is cold laser. And we use quite a bit of cold laser for all of our athletes and our patients for that matter. And laser is an energy source that actually helps the body heal at the cellular level. And we use this quite a bit and seen significant response and shortened recovery times, and including decreased pain or an increased range of motion.
Well, Tom, I have to say you've talked about the capabilities of Eric and some of the other therapists and things, but unless I'm mistaken, you're kind of the back guru there, are you not?
It kind of started, I learned a lot about backs early in my therapy. I had set a career. I was doing some work with Jacob today, and we were looking at a bunch of different things and different types of treatments and talking about backs and necks and spines. And I told him earlier in my career, back in the late 70s, I had an opportunity to travel to the Canary Islands for 3 weeks at what was called an international manual seminar. And it was run by all the top manual physical therapists in the world. And I had a chance to study with these people for for the 3 weeks, every day. And we studied all types of therapy. We practiced on each other. It was kind of a fun setting because we were by a pool and we were outside and we were in our swimming suits and we were doing all of our work outside in the sun by a pool. But it was really educational. It was really well worth it. And I told them that what I do now for backs and necks, I learned most of it at that particular seminar, and then I've learned over the years the experience. When I got here, I was kind of fancied myself as a sports medicine guy. Part of my background in Minneapolis was I'd been a physical therapist for the Minnesota Twins for 10 years and the physical therapist for the Minnesota North Star professional hockey team for 10 years. Prior to that, I worked in the office for the trainer for the Minnesota Vikings and saw professional football players for 10 years. So I kind of fancied myself as a sports medicine guy. Well, I got here, I guess some of my stuff might have gotten a little old, and Eric was on top of it. And he knows stuff like I never even dreamed of. And so everybody backs are difficult to say the least in terms of figuring out what you need to do to help people get better. So, because I was kind of the experienced guy, every time we got a referral for back, they said, here, you take it. Here, you take it. And pretty soon I got to see just about all of the spine problems, backs and necks. And I do really enjoy it because over the years with the experience and seeing so many different things that I've come to enjoy being able to identify, for the most part, what's going on with the person, having learned how to manage that particular problem and see people get better and I love it when they've been somewhere else and they haven't done well and they come and see me. It's a challenge to get that person better. And the one thing that we have done is when we built our new practice, we have 6,500 square foot facility. Helen said to me, she said, we've got to have a pool. There's no pool in Central. There's no aquatic therapy in pool. If you go outside of Central, you go to Zachary, you go to Denham Springs, everybody's got a pool and they're full. We have to have a pool. And I said, well, I don't know much about pools. I've never worked with one, but okay. So we studied it. We actually designed our own pool to fit the space we want. We had some ideas of things we wanted to do in the pool, so we designed the pool for that. And the way that water has turned out in terms of back care has been phenomenal, because we can take patients that have significant back issues, particularly if they're in the area of spinal discs or bulging discs, and put them in that water. And with the right approach and the right alignment, we can relieve pain within minutes of many of these back pains because of the buoyancy of the water, because of the warmth of the water, and because of the decompressive qualities of the water that allows you to take pressure off the back. Mm-hmm. And then the beauty of that is, of course, most people who come in with spine problems have had pain for a fairly long length of time, because, again, like I was explaining to my people most recently, getting to therapy is an arduous process sometimes, because you have to first understand you have a problem that just didn't get better. And then you're going to have to think about, well, what do I do to get this better, and what doctor do I go see? Then you get into your doctor after a period of time, and then the doctor has to recognize that, hey, this is a problem that needs to be treated by physical therapy. So I'm going to send you to a physical therapist. And of course, we want them to say, I want to go to Central. I want to go to Central. And then when they get to us, they've had sort of a long-term process of pain that just has made them inactive. And when you're inactive, that inactivity works against you, because you need to have good core strength, you need to have good back strength, you need to have good flexibility of the spine in order to have a healthy spine. And when someone gets there with all of these things going on, it's hard to do on a treatment table or a mat table. but you put them in the water, you put them in this buoyancy with decompression, and you have them start to do what we call our decompressive hangs, where you just hang in the water. In fact, we even put a little weight on your ankle, a little noodle around your shoulder, so you got a ring that just kind of hang and stretch and decompress. And after you've decompressed for a period of time, you can actually start doing some of the work that you need to do, some of the core work, some of the flexibility work you need to help get a healthy spine in the water, because the decompressive qualities have helped relieve the pain significantly. And you can make a lot better progress in patients, a lot better, a lot faster, and just have a whole lot better result with your back patients because we're put in the pool. And I told Helen just this morning, I said, I'm almost getting a little bit lazy with my backs. I do the evaluation and figure it out. And it used to be I'd have to do this maneuver and that maneuver and this ultrasound and push this leg or that leg. I said, now I can just put them in the water, let them hang there and talk to them while the water does all the work. But the results are so much better, and our patients enjoy it and they love it. And we have quite a few people every day in the pool because of the characteristics and the nature of what the water can do for them.
Well, true testimony, Tom. My wife had a disc issue earlier this year, and she went to a neurosurgeon and said, look, all kinds of CT scans and everything said, okay, you need surgery. You know what my wife said? She said, I got to go see if Tom says it's okay. So she wouldn't go until she came to you.
I remember that. I said, okay, now you've got me in a spot here, Mia. So, but at any rate, I agreed, and I agreed with what he needed to do, because I treated her as much as I can. And unfortunately, physical therapists can't fix everything, and we do need to have a doctor once in a while to help us out. So she did require what he was suggesting, and it was very simple, very quick. And when she was done with that, she came right back and we went back to work. So I'm very happy with the way this turned out. So for sure, and that's not unusual for a lot of things that we're able to do and able to see in our practice.
Hey, Tom, my last question or point I wanted to bring up, and you mentioned it a little bit, but make sure all Central residents and outside of Central realize that you have a choice where you go for physical therapy. A lot of doctors will recommend, obviously they have relationships, and some doctors have their own PT, right? In-house type of thing, but you're Central resident, you can ask to go to Central PT.
That's right. And that's another thing I was impressing on both Sarah and Jacob as they came in, because they're young, they're eager, they haven't had a lot of experience. They've had some. They're both certified athletic trainers. But where they've been, the standard for getting the word out there and putting a face on your business is you go talk to doctors, or you go in and sit down and talk with a visit and take your brochures and stuff. And I said, that's not what we do. We talk to the people of Central and say, when you go see your doctor and he recommends therapy, ask for go to Central PT. That's how we really approach it. I think I was on, I can't remember who I was talking to a few weeks ago, but they said, well, what all do you do to go do your marketing? And I said, well, we go shopping at Walmart. We go to Winn-Dixie. We go, down to the mobile station for lunch, and we see people there and we talk to them. And that's where we get a lot of our visibility of what we're doing. Of course, the best thing, Gordy, as you know, is word of mouth. And that is doing the job, doing it as best a job as we can to help our patients get well. And if we can do that, then they go tell their friends and tell their friends that, hey, Central is the place to go for your therapy. But yeah, thanks for that observation, for sure.
Well, Tom, I think you ought to have a blog. You ought to start your own blog and just talk physical therapy once a week. Just get on for 20, 30 minutes and educate us on different topics.
So when you get me going, it's hard to, they say, you never say much until I start talking about one or two things, physical therapy or my grandson Booker. So I just talk and talk.
Wait, have I mentioned that I have a grandson too? I do that. I work that in every show. My grandson's a year old now. So
right. Well, you know, interestingly enough, before I came down here, I did have an hour Saturday mornings on NPR, Minnesota Public Radio. And I did that for a couple of years before I came down here. So, like I said, I have a face for radio. But
Well, Gordy, Kristen, thanks for joining us. Tom, thanks for your time and for your expertise and what you and Helen do for the community. And you did say it right. Helen's a mover and the shaker when it comes to what people know about physical therapy in Central. We're so glad to have you having joined her and y'all taking this to the next level. And it's just great to have you as a part of this community.
I appreciate you asking me to be on. Thanks again.
All right.
And good to see you, Gordy. It's nice meeting you, Kristen.
Yes, nice to meet
Till next Monday at 8, Go Central.
you. Bye-bye.
Bye.